Hello and welcome everyone to this series of drug pictures of children remedies. The reason I decided to speak on this topic is because parents trust homeopathy for their children. However, the information given by parents in their first interview might not be accurate, which might be the cause of failures in our practice. And in order to minimize these failures, I thought to make some series of videos on some most common children remedies in practice. This information is taken from various reliable sources like Professor Vitholkas, Dr. Vasilis Gigas, Dr. Rajan Shankaran sir, late Dr. Praful Vijayakar sir, and many more. Today, I will be sharing some sure, reliable symptoms of the remedy Calcarea carb. So as you see, the first thing that you observe in a child is how does the child look. And a Calcarea child typically looks fat, flabby and fair. They are often soft and cold and clammy to touch, with a double chin as you see in the picture. However, there is another variety. That is, these children can be thin as well, and they are tall babies with prominent bones, and especially the prominent jaw bones or a jaw line with a squarish face. If you examine them or check them, you see that the radius and the ulna are longer, the bones are thicker, the knuckle bones are prominent, and they have projecting tubercles or tuberances, especially the occipital protuberance. We come across in clinic many children who are prone to recurrent tonsillitis, pharyngitis, adenoids, and many upper respiratory tract infections. Calcarea carb or Calcarea group of remedies is surely under consideration. In fact, I had read in some of the books of a reliable physician or an author who said that 40% of your pediatric practice or children practice is based on Calcarea or Calcarea like group remedies. You see, they get tired easily, especially on ascending. Ascending or climbing the hill or exertion, physical exertion, is a strong symptom of Calcarea carb. Let us understand some physical generals of this remedy. It is important for any physician to get physical generals in every case and be alert to spot those symptoms which are intense, spontaneous, and clear. Firstly, the Calcarea group perspire easily and especially on the neck and in their sleep. They wet their pillows. This is a confirmatory symptom of Calcarea carb. They have a strong aversion of milk and usually like soft boiled eggs, sweet, sugar, ice cream, and salty things. If there is a strong desire for salt and sugar in children, you think of Calcarea. And if the same desire is present in adults, then you think of Argentum nitricum. Pulsatilla and silica have a strong desire for hard boiled eggs. These differences have been picked up from a reliable book written by Dr. Vasilis Gigas. Now let us understand the fears of Calcarea. Fears are most intense, clear, and true in children cases, and hence it should be explored fully. A Calcarea child is full of fears. They are scared of animals, angels, devils, darkness, nightmares, death. There is a sense of insecurity, a danger to life, and this is the essence or the core or the soul of this particular remedy. Anxiety about salvation is mentioned in our books, but how does this reflect in our clinical practice? These children are very afraid of death of their parents. This makes them insecure and thus they keep asking questions about life after death. And if you come across a history in a child who asks such questions, then surely think of Calcarea carb or a Calcarea group of remedies. Vertigo and fear of high places. This is again a strong symptom of Calcarea. Many times I have used this symptom and perspiration on the back of the neck as confirmatory for Calcarea carb. Thank you for watching this video. I hope you get the gist of how a Calcarea child will present in your clinic. You see a fat, flabby or a tall, thin boy with prominent jaw bones or knuckles or tuberances with fear or insecurity to life as its essence. This kind of picture defines Calcarea. If you like such videos, do press the like button, which will motivate me to make more such videos. If there is any other topic you want me to make videos on, please write to me. Thank you once again for your time and attention.